While Purva is coming up, I'd like to introduce her. She's the Chief Strategy Officer at the Center for, sure, have a seat right there. She's the Chief Strategy Officer at the Center for Medicare and Medicaid Innovation, part of the senior leadership team there. And, having had the opportunity to work with her on these SDC issues, on a whole host of other issues around care transformation, she really does manage to take a very broad perspective of not just what's going on in her part of CMS, important as that is, but coordinating efforts around advancing care reform across the agency and bringing in perspectives from other parts of the federal government. And you've been on the road some too, I think, right?
Yeah, it's nice to get out and actually hear from people.
Yeah. And so here you are in North Carolina, not our best weather day, but glad to have you here. That's right. It could be worse, right? All right. So you've heard a lot about what the SDC here is trying to do. You've heard about some of the specific strategic goals and maybe concrete actions to get there, like quality measure alignment, aligned priority measures related to improving equity, key data sharing, sharing best practices, technical assistance, and some trying to work in steps to advance the behavioral health priority that really matters to North Carolinians from the Secretary on down. How does this match up with what you're seeing nationally and the national goals related to CMS, strategic transformation, STC efforts more broadly, et cetera?
Well, I guess I'm relieved and maybe great minds think alike, because I'll talk a little bit about our strategic refresh at the Innovation Center. And when I was learning more about what the STCs in North Carolina or the STC in North Carolina is embarking on, it really struck me that there is an amazing level of alignment and synergy across what we're thinking and what we've put forward over the last year and a half and where we're headed, and hopefully we're all headed together. I think Secretary Kinsley summed it up nicely by saying, we want to focus our effort on the things that are important. And so the more that we are all kind of aligned on priorities, I think it allows us all to focus our energy and resources, which of course are always more limited than we want them to be. So about a year and a half ago, the center, CMMI, embarked on a strategic refresh. We took stock of over 50 models that we've launched in the first decade, really tried to understand what lessons we learned from those 50 plus model launches. We talked to a number of internal leaders at CMS, external leaders, as like Mark, to really think about and chart our path forward for the next decade. That how do we, as the Innovation Center, of course, launch new national models, but how do we also interact differently with states and state efforts, and how do we embed ourselves in those as well to drive greater system transformation? And out of that effort really came 5 strategic objectives. And I'm going to walk through them because they align so well with a lot of the discussion today. And the first is really to drive accountable care. We want to have 100% of our beneficiaries in Medicare fee-for-service beneficiaries, the vast majority of our Medicaid beneficiaries, in accountable care relationships by 2030. And that means we're really focused on advanced primary care models and ACO models as the mechanisms to be able to deliver that accountable care. And I know that is top of mind here in North Carolina. This is a very innovative state with a long history of innovation in primary care. And so I'm hoping that that's a place where your input and your feedback and the work that you're doing on the ground, your priorities can help inform our work and shape our future model development.
And by the way, for those of you who think that, 2030, that sounds a long way off. You put in some numbers. Well, first of all, it's not that far off. And second, you put in some numbers that are a big level beyond where we are today in terms of coordinated whole person care for Medicare and Medicaid beneficiaries and others in our health system.
That's right. Yep.
Much sooner than.
In November of this past year, we released a 1-year report on our strategy and where we've been on implementation over the last year and where we're headed next. And as part of that, we've set some metrics across each of these 5 objectives, including our accountable care metrics, to get to 100% by 2030. So I think we have a 2025 goal of, don't quote me on this, but like 60% to help us get there. And models like our ACO REACH model, our primary care first model that's operating across the country in the future, advanced primary care model, those are all going to help us get there, along with our work with the shared savings program.
And you said 4 other areas.
Yeah. So the second is advancing health equity, which we heard a lot about today. I can talk more about that if we want, but really data collection. It starts with data collection. We have some required self-reported demographic data collection efforts that we're launching through our models. We're already getting early feedback from some of our model participants about what's working, what isn't. And that's obviously an area of alignment with everybody here. Our third objective is supporting innovation. A lot of our data objectives here, so data access, standardization, some of those objectives sit there. And I know obviously data and quality measurement were the two things that we heard the most about today. We also are thinking about quality measure alignment across CMS as part of that effort, and also thinking about patient-reported outcome measures, which also came up today. And I know that that's part of what you're talking about in North Carolina. So not only do we want to get alignment across programs and across payers, but we also at the Innovation Center want to be thinking with an eye towards where should we be pushing next on quality measurement? What can we be testing in our models to get to more meaningful measurement over time and inform the broader Medicare and Medicaid programs? The fourth is addressing affordability, which I know that's a big overall goal in North Carolina with a lot of the strategies feeding into reducing cost for families. And the fifth is partnering to achieve system transformation. And the STCs are really being the work that Kate's leading is really important for us to be getting out there, to be hearing from folks, and hopefully be joining the table. There, you guys are already have a number of efforts underway in North Carolina. I really view our role as us coming to the table to hear from you and to see how our work can help accelerate the efforts here.
Okay, so that's a lot. And I would just say, add to that, and you talked about this as being an innovation center-led effort, that strategic refresh that you published included a lot of perspectives from not just the Innovation Center, but efforts to kind of align across all of CMS.
Yeah, so I can talk a little bit. I can give a couple examples of some concrete ways that we're trying to get that kind of alignment. I think Kate did a great job earlier of talking about how we're trying to align on quality measurements specifically. And again, yesterday's paper, I was so glad it came out at 5 o'clock yesterday. I was like, thank God. So what we released was a set of universal, what we're calling universal foundation set, where we want to be able to at least get alignment across CMS programs on a set of quality measures. And then at the Innovation Center, our goal is to align with that measure set wherever possible. Obviously, there might be deviations if we're testing something in a specific population, but also places where, again, we can get to a more parsimonious measure set and really be pushing the envelope on patient-reported outcome measures. But that's a across CMS, initiative. We're working with our colleagues at HRSA again. I think the other place, another example I would point to where we're working again outside of the Innovation Center, working with our colleagues, is our ACO vision and our ACO strategy, where I think for the first time, CMS was really able to put a Medicare ACO vision strategy together. We published that last April, and you started to see some of those changes come out in the Medicare physician fee schedule this year. And hopefully over this next year, you'll see greater alignment between CMMI models and the National Permanent Shared Savings Program. I'll just give you one example of why that kind of alignment is important, because as we're testing innovations, and hopefully some of those in North Carolina will be part of some of that testing and some of those innovations, we have to figure out what works and what doesn't. And if something doesn't work, we don't keep going there. But if something is working, we want to find a way to scale it more broadly into the Medicare and Medicaid programs. And so that's what we're able to do the more that we're aligned across the agency and with the Center for Medicare.
And you talked about alignment across CMS and some very important steps. And again, good timing with that New England Journal article too. If
We've
people
been waiting for it.
So, and you talk about your fifth priority being system change and how important partnership is for that. So alignment across CMS, that's a very important and challenging step, but you're aiming for much broader alignment than that, including through the STC. And I think if people can stand, we have like one more slide. If people can stand, are putting it up. See a thumbs up. So you mentioned it. So this is a list of, well, that's us. This is a nice picture of you too. This is a list of CMS alignment efforts that some of which you've referred to. So the Medicare Shared Savings Programs, that's the main statutory kind of workhorse ACO program, which is now increasingly aligned with pilots at CMMI that are filling in at the high end, the very advanced ACO reach, and filling in for the providers, especially the smaller, more rural ones, some of the smaller safety net organizations that had trouble getting into the program so far. You've talked about quality measure alignment. You've talked about some of the steps that Medicaid is taking to make it easier to pay for so-called in lieu of services and so on. One of the things that we're seeing coming out of this is the opportunity to make it clear to everyone in North Carolina who also cares about these issues that, having formerly been administrator at CMS, this is not an agency that turns on a dime. I don't think you'd want that anyway, and Congress is never going to allow it. There are a whole bunch of regulatory processes and authorities that CMS has to operate within. But these are, thanks to efforts by CMS, these are getting to be more predictable and ones that you can anticipate. So for example, CMS laid out its next priorities, which very much align with what we've talked about here for supporting more aligned quality measures across programs, for building out steps to strengthen primary care and help provide a better on-ramp in its regulations this past year for healthcare organizations. And that's a process that we know is going to happen again this year. There's going to be a comment process. There are going to be further steps that permit alignment. There are going to be further steps on the quality measurement approach. One of the things that we're hoping to do as part of this STC, and where your involvement and CMS actually being here is very helpful, is making sure that people know about that. So as we make progress on these particular priority areas, CMS may not be able to align right here, right now on what some of the things that the state would like to do collectively, but there is a process that hopefully can become clearer. What do you think about that?
Yeah, I mean, I think the more clarity that we can give, and I think it's always tricky, Mark, as you know, running CMS, that there's a lot often that's happening, but that we can't talk about publicly. And so it's always towing that line between how do we get input from interested parties, and how do we signal where we're going? And it's sort of this kind of little bit of art more than a science, I'm finding, but I completely agree. I think there's a regular cadence of rulemaking and things that happen every single year that we can use to, hopefully continue to send signals about where we are headed and what those points of input are. I think what's difficult sometimes about innovation center models, and I know there's some former CMIers in the audience here who can, who can back me up on this, but we're often disruptors. We're not working through the regular cycle and the regular rulemaking cycle, but that again, within CMS, even one of the things the Innovation Center is really trying to do is understand and make sure that when we're thinking about models and launches and working with states, that we're aware of what the cadence of activities is at a state level, what the cadence is within the agency and other parts of the federal government, so that that disruption is, in the context of all everybody's goals.
And what we'll hopefully be able to do as part of this process of your commitment to alignment and everyone working together towards these common goals is maybe flesh out that those rules that are coming. People here I know have better things to do than keep track of every single CMS rulemaking calendar, but we can hopefully make it easier for them and slot in the steps that the state is thinking about taking and what time frame that relate to this, and slot in the steps that our private sector health plan partners and others are.
I think what was really helpful is like hearing about the strategies and the priority areas in North Carolina. And that's why if the STCs can be a blueprint for how this can happen in other states, I think this could be really powerful, because what you've done is you've laid out 4 areas. And my mind was going to, well, here are the things that are coming or that we could be doing together. And so what it allows us to do is, again, you don't need to boil the ocean. You don't need to about every rule, but for the priorities that the state has outlined here, the collaborative has outlined, where are those kind of, entry points for you all as well, and those points of connection with the agency?
Well, we really appreciate the concrete steps that you're taking so that this isn't just a strategy, but back to the theme for today. Okay, what are we actually going to do differently that will make a difference? And that seems like it's going to apply to opportunities for the collaborators here to work with CMS and other federal agencies. So Purva, thanks for taking the time.